I'm Hilary Tsumba, co-chair of the Home and Community-Based Services Committee of the Montgomery County Age-Friendly Initiative. In today's discussion, you'll have a chance to learn what home and community-based services are and how Montgomery County, Maryland's partnership approach works to make those services accessible to residents who need them. Broadly speaking, the committee is composed of a group of representatives from the public sector and from private organizations who have a shared goal of helping people to age well and age in place. Our goal is to provide Montgomery County residents with coordinated, personalized community-based support, allowing them to age safely and with dignity in their communities. Our priorities include, first, support for residents and caregivers of older adults. Second, simplified and streamlined access to home and community-based services resources for older adults. And third, optimized navigation of those resources. It's my pleasure to introduce our panelists for today. Lylie Fisher oversees the Caregiver Support Program in the Montgomery County Area Agency on Aging and co-chairs this committee. Steve Loberbaum is owner of Assisting Hands Home Care and one of the county's many home and community-based services providers. And he participates on the Home and Community-Based Services Committee as a representative of GROWS, an advocacy group representing senior services providers in Montgomery County. And Marcia Prizan is a senior fellow in Montgomery County Aging and Disability Services and manages the Age-Friendly Initiative in Montgomery County. Each panelist will provide opening remarks, and then we'll have a moderated discussion.
Thank you, Hilary. I am delighted to be here today to be able to tell you all about Age-Friendly Montgomery County and the Age-Friendly program. I'm guessing that many people are unfamiliar with Age-Friendly, with the program, and the fact that Montgomery County is a designated age-friendly community. The Age-Friendly Initiative is an initiative of the World Health Organization and AARP. It is a global initiative to ensure that the needs of the population that is aging rapidly all over the globe are being addressed and met. It's helping localities prepare for the challenges that the aging of the population brings. It is currently in 41 communities across the world, and in the United States, more than 500 localities and 6 states are designated as age-friendly. Montgomery County is one of them. You may be surprised to know that there are some startling statistics about our population. Here in Montgomery County, we are aging rapidly, and we are becoming more and more diverse. We expect that in 10 years, nearly 25% of the population will be 65 or older. And in 15 years, we think that more people will be age 65 and older than we will have a population of younger people, 18 and younger. So we have a vision in Montgomery County that this is a wonderfully diverse, dynamic community. It's a community for a lifetime. We want people to be able to live here, grow up here, go to school, work, raise families, and stay here as they retire and age if they care to. And we want them to care to. So it's our older population in this county is a very powerful resource, participates in all areas of county life, and we want it to be and remain a stronger, better, more inclusive community for all ages. So how did we become age-friendly? Well, in a matter of speaking, we have always been age-friendly. For decades, we have been very attuned to the needs and challenges that older residents face. We've always had strong support from our county's Commission on Aging, from our county executive and our county council. Many years ago, about 12 years ago, the Commission on Aging developed a senior agenda, which sort of laid out the principles of commitment to older adults in the county. And it was supported by the county executive and the county council. Our previous county executive, Isaiah Leggett, also organized 2 summits on aging several years apart, bringing in experts from around the county, from all parts of the county, business and nonprofit community, faith, and so forth, along with county government representatives, to look at various issues affecting older residents and try to decide on the best ways to meet the challenges. He also organized a senior sub-cabinet, which meant that the heads of all of the departments in the government met together to be sure that they, in their programs and services, were supporting the needs of the older residents. So based on that, we applied for and were enrolled in Age Friendly, the Age Friendly Global Initiative in this country run by AARP. And we were enrolled for the first 5 years in 2015, and we just in October 2020 received our second 5-year certification. And how does it work? Well, as Hillary said, it is a beautiful partnership of government and community partners all working together with common goals, people to meet the needs of people really of all ages and backgrounds so that they can thrive here throughout a lifetime. And I want to reiterate that whatever we do for our older community is beneficial to the whole community. So it truly does affect all ages. So our partners include federal and local government officials, arts, businesses, members of faith-based and ethnic communities, educational organizations, healthcare, lifelong learning organizations, transportation, and more. We are set up as a partnership. We have an advisory group of outside experts in the community who advise us and help guide our programs and services in the county. And we work in 10 areas of focus. Hillary mentioned one, which is home and community-based services, which she described beautifully to you. Over all of them is communications. We have to be able to communicate well with all of our population, all segments of our population, so that everyone out there knows about our programs, knows how to access them, knows which ones they would like to take part in. Because we are so diverse, it is somewhat challenging. We have many, more than 100 languages. I think close to 160 different languages are spoken in this county. So we have to be mindful of reaching all segments of the community, regardless of their language skills. So another one is civic and social involvement. That work group concentrates on volunteerism, on lifelong learning, on being sure that our older population has access and understands how to use technical equipment and the internet and email and so forth. It helps build leadership and programming for diverse communities. It is concerned with intergenerational programming and villages. And villages are a national movement of grassroots organizations within communities where volunteers get together within their communities to help older residents stay in place if they wish to stay there and age in place. And it's very big in Montgomery County. The Villages movement, I believe, has 25 or more established villages already in Montgomery County, where residents are neighbors helping neighbors. We have an elder abuse prevention work group that looks at educating people about abuse, both financial and physical, and combating it where they find that it occurs. We have an employment work group which is concerned with ageism in the workplace and with helping older workers and older job seekers find and maintain their work status if they care to. We have a health and wellness group that is concerned with the physical, mental, and cognitive health of our residents and is concentrating right now on one of the major challenges that the pandemic has heightened, which is social isolation. Our housing group tries to plan for affordable, accessible housing so that residents who grow older in this community can stay here in the housing of their choice. We have a planning and open spaces group that looks at community buildings and parks and open spaces to make sure that activities by any age are accessible and welcoming and inviting to all of our residents. We have a senior public safety group that looks at education and safety to protect residents in their homes, in the outside world around us, and through technology. Help you plan to keep your home safe from fire or from other kinds of emergencies, from crime, whether you're in your home or out on the street. And we have a transportation and mobility group that helps people go where they want to go, when they want to go there. So we have regular meetings amongst all of these groups with our advisors and together, so that we can learn from one another. We can hear experts educate us about issues we need to know more about, and we can look for areas where we can collaborate on various issues of importance, where maybe 2 or 3 or more groups are working towards the same goal on a single issue, and where they can find means of collaboration and doing it more efficiently together than they could separately. So I wanted everybody to know about and understand what age-friendly means and what it means here to our community. It's been an important structure for us to work better together as a community with our partners inside and out of government, and work on all aspects of life in this community for the benefit, not just of the older population who are both healthy and vibrant, and those who are more vulnerable and need more help, and for every age. Thank you very much.
Thank you, Marcia, for that great overview. As you shared, the Age Friendly Initiative is a public-private partnership, and now it's over to Steve, who's going to talk about the role that private agencies play in making that partnership successful. Steve, over to you.
Thank you, Hillary. I'm going to cover a variety of topics. First, I'm going to talk a little bit about GROWS. So GROWS is the grassroots organization for the well-being of seniors. And it is a group of like-minded professionals who all serve the senior community. We focus on education and advocacy and networking, so we get to know each other and know the resources that are available to seniors in our community. It's a terrific organization. You can go out to their website, growsmc.org, and you can actually, it has a list of members, and you can look and find people that might be of use to you as you're looking for assorted types of care. So I'm going to focus on resources, and one of the most important resources for me are aging life care professionals. They are also known as geriatric care managers, and you can find an aging life care professional at aginglifecare.org. And they're like the quarterbacks. They're folks who have vast knowledge and resources that can help you if you need a new doctor, if you're trying to figure out, should I stay at home or should I move to a community? If I need other assorted resources, they can help with that sort of thing. And they can help find a home care company. So one of the things that I focus on is providing care at home to supplement the work of family caregivers. So most care in the United States is delivered by family members. But family members get exhausted and they get worn out. And it's important that family members keep their health and keep time for themselves, because oftentimes if a husband and wife are living together, husband needs care, and if the wife gets worn down and injured, then the whole system breaks down. So it's important that the caregiving member of the family reserve time for themselves, and it may be that they need a private caregiver to help out, a professional. So there are 3 ways you can get a private duty home care assistant. In Maryland, they're all hopefully going to be certified nurse aides. So you can hire a private person, and those people could be anybody. So people hire people from their churches or someone they recommended. I would always stress that you ensure that they're certified nurse aides. So they're licensed with the Maryland Board of Nursing, and they have the level of experience that is necessary to take care of your loved one. You can also use something called a registry. A registry is really like a headhunting service. So you will call them and they will find people for you. It's kind of like care.com, but it's a phone number and a group of local people and local owners that you can call. And they will get you somebody, and you'll be hiring them as an independent contractor. And I'll go into the pluses and minuses of all 3. And then the third are agencies like Assisting Hands. And what we do is we hire certified nurse aides, and we have nurse supervision, and we have 24-hour service where we're available and on call, and we have a nurse on call to answer any issues and questions. So which one do you choose? Well, that's very much a personal choice. I look at it as what's kind of the most important thing. If money is the most important thing, then generally speaking, hiring a private caregiver is going to be the most cost effective. But there are downsides, because you're the one that has to hire and fire that person. You're the one that has to vet that person. You're the one that has to manage them. And you're the one that's going to have to withhold taxes for them and ensure that they're covered by workers' comp and general liability insurance, so that you make sure you're doing all the work, or someone in your family is, to make sure they're doing their job. There are wonderful caregivers out there that are private caregivers, but you're doing all the work. A registry takes a little of that work away, and as a consequence, it costs a little bit more. And so the registry will find you the people. So they're doing the vetting for you, and oftentimes they'll even pay the caregiver as a 1099 contractor for you. And then there's what I'll call the agency model, which again is what I know most. That's more focused on doing it all. It's relieving the most amount of stress on a family, but it costs the most. So, ranges, it's hard for me to give ranges because things change over time and COVID has impacted things. But generally, a private caregiver might cost in the range of $18 to $21 an hour. A caregiver through a registry might cost $21 to $23 an hour. And it may include a fee to the registry in that or on top of it. And agencies might cost $27 to $30 an hour, depending on the agency, the number of hours, where it's located, the complexity, a variety of things. So you have a lot to choose from. There's tremendous information on the county websites, where now you can get a download of questions to ask various agencies to make sure you know what you're doing and you're getting the most information. So it's complicated, but I encourage you to get help and don't try to do it all. I know no one wants a stranger in their home, and especially during COVID, no one wants a stranger that might bring COVID into the house, but it really is important to get a break when you need it. There is also a private public program that helps out with that. It's called the ARC. So ARC of Montgomery County will offer respite money, so they will help subsidize the cost of services through agencies that are authorized and approved through ARC. And they will pay right now about $24 an hour against the cost of about $27 an hour. If you're a Montgomery County resident and you're over the age of 65, you pretty much qualify as long as a doctor will sign off that you need help. So it's a tremendous opportunity to get subsidized care. It's limited to about 40 hours a month and 140 hours over the course of a calendar year, but it is a tremendous resource for someone that just needs a periodic break from time to time. So I encourage you to look into that. There are lots of other resources available as well, and I encourage people to look at Parkinson's.org and Alzheimer.org, because there are a variety of support groups out there that are now mostly meeting virtually, who can help people who are living with similar diseases. So not only do they help loved ones, but they could also help the person that's suffering from the particular disease. It's very important to get some other insight, because chances are what you're living through is not new. There's other people that are sharing the same challenges and hardships that you are. There are also daily money managers out there, and they can help with managing and paying bills if you need help with that. There is, for transportation, there's Metro Access, and there are private transport organizations out there, including Uber and Lyft, who now have senior transport services as well. There are Meals on Wheels programs, and right now, one of the things that COVID has helped with is there's all sorts of now food delivery services that are out there that will deliver both pre-made and unmade food right to your home. It's easy. You do have to go online, but if you're not a technologist, you might be able to get a friend or family member who can help you out. I don't want to lose sight of the villages, which is something that Marcia talked about. Villages are neighbor helping neighbor nonprofit organizations. If you need a ride somewhere to a doctor, They will oftentimes have volunteers that can take you to a doctor appointment or take you to the grocery store. They have all sorts of social programs now as well. So again, mostly all by Zoom. They're not meeting in person, but tremendous wealth of programming out there for members of those organizations. They do friendly calls. Some are now getting back to doing friendly visits. So some will have people that can come over and help with technology. So there's a variety of services within the county to help people that are either free, because the villages don't cost anything, or they have an annual membership that varies depending on the village. Metro Access, again, is a free service. There are money through ARC. So there's a lot out there. So think about what you need, and you can call a care manager and get a sense. There are county programs which will provide some care management support services as well that can help you down the path to what you might need. So again, take time for yourself. Make sure that your loved one is safe. You've got to overcome that no one wants a person in their home, or no one wants to admit they're not on their A game, because it is really critically important that people stay safe in their home and they get the care that they need.
Thank you so much, Steve, for sharing all of that great information. One of the things you spoke about quite a bit was the importance of family caregivers having the support that they need. And we're fortunate here in Montgomery County to have a county family caregiver support program. Over to Lily to share more information about that.
Thank you so much, Hilary. It's wonderful to be here today. I wanted to start out and acknowledge the partnership that we have with GROWS in Montgomery County. It is those public-private partnerships that allow family and friend caregivers to do the most important work that they do as volunteers. And as Steve articulated so well, that doing it by yourself isn't always going to be the best approach. And our members of GROWS are available to provide support, both in-home care. Maybe it could be that you need to see a specialist in the community. The GROWS membership really have a great team of folk who are generally private businesses. And as Marsha shared, that we do have so many community-based organisations, and it's those community-based organisations that are going to continue to be there for family caregivers. It may be your congregation, it could be your village, it could be friends, other families. To be that caregiver, what it takes is the idea of collaboration. And I speak to a lot of caregivers in the community, and one of the things that I know can have resistance, that idea that you would do it all yourself. And maybe your loved one has communicated at some stage to you that you should be the only person providing care. One of the things that I have also learned is that, generally speaking, caregivers can get tired and overwhelmed. If someone is younger and still trying to work, it's a huge juggle. Then if they have their own younger family themselves, or if someone is a little older, they may have retired, they're themselves going to be having some challenges associated with aging. And if they're then having to lift up that extra effort to provide care for someone, it can be really challenging. And such simple things as having a home health aide coming into the home, even if it's for a couple of hours a day, you know, some of the most amazing breakthroughs can happen when a caregiver and their loved one recognize that, say, getting them out of bed, helping them shower, get dressed, sit down and have their first meal for the day, that can make the difference between multiple hours spent by a sometimes frail caregiver trying to navigate bathing with their loved one. So Steve talked about this idea of having aides come into the home. And in Montgomery County, we have an amazing program. It is called our Respite Care Program. And that and other programs can be explored by contacting the county's Aging and Disability Resource Unit. You can contact them on 240-777-3000. Our team is available to assist you to really identify what are the public-private partnership resources that are going to help you make things better, help you do what you want to do, both in your private life to keep yourself healthy and to actually provide the care for your loved one. Additionally, the county has produced an array of resources in multiple languages. These are available 24/7 on our website. The website address to the county, age-friendly, grows, and other resources we mentioned are going to be in the description of this Engage at Home episode. So with these online resources, you can better understand what would be your responsibility if you were going to be an employer of an aide. It helps you understand what the qualifications are for different aides and what sort of tasks that they can do with those qualifications. And then, as Steve mentioned, help you understand what the differences are between getting that support through an agency that's going to have supervision, licensing, and bonding, or if you try to find someone yourself. Generally speaking, if you find someone yourself, you also aren't going to have backup. If you get sick, you're relying on a care provider. If that care provider gets sick and you don't have backup, you're maybe in a worse position than you actually started. So on a positive note, what we do in Montgomery County and through our age-friendly group is to really identify what are the challenges that caregivers face, how different providers from those different public-private sectors can work in collaboration with each other, make recommendations to the county, and discuss ways that through collaboration, we can all work together to find a better way of supporting caregivers. I mentioned our respite care program. At the beginning of COVID, we all were cautious. We all were really concerned about illness, bringing illness into the home, and that's most understandable. But now, 6 months later, 7 months later, we are very proud to say that both the county and our care provider organisations have really stepped up. They and the county have worked in collaboration and independently to source the appropriate protective garments, to really understand what are the protocols to ensure that everyone keeps safe. The aide coming into the home is safe. The care receiver of that care is going to be comfortable and safe, as will their caregiver, because they are seeing proper protocols with gloves and masks and gowns. It's an expensive task, and I really take my hat off to our independent providers like Steve, who have invested enormously in protective equipment. Now, COVID is still with us, and one of the ways that we are all going to be able to make sure that we are healthy, the people who we're caring for remain healthy, and the folk who come into our home are healthy, and that is through testing. Montgomery County has testing at locations, and we also can provide testing in the home. There's a lot of details associated with this, but it's simple. We will put the links to how to either get testing at a location or to bring testing into your home. To remain healthy as a community, it's really going to be about following the appropriate ways of staying healthy, to be able to, as a caregiver, reaching out, utilising the county resources, utilising your local villages, and working with our public-private partners so you and your loved one stay healthy during times of COVID and beyond.
Thank you so much, Lily, for that. And we're going to move now into a little bit of discussion. You've all got such great expertise to bring to this conversation. And I'm sure that you'll be able to add more to what you've already shared and also to play off one another's remarks. Lily, first building on what you were just talking about, can caregivers still get support from the county during COVID-19?
Absolutely, and that's a great question. So Steve and his company are part of a consortium with the Arc of Montgomery. They provide for the county our respite care program. And that's one of the direct ways that family caregivers who are living in the same residence as their loved one can get care. I'll put the details in the description. If folk would like to start exploring what kind of resources are available provided by the county or through our community partners, the best way to do it, and we are operational, is through our Aging and Disability Resource Unit, and that phone number is 240-777-3000. They are available and they are ready to take your call.
Wonderful. Thank you so much. And thinking more broadly about the community's response to COVID, Marsha, you were explaining how Montgomery County has a global view to addressing the lifetime continuum through the Age-Friendly initiative. Could you talk about, what are some of the innovative things that the Age-Friendly Montgomery program has developed to support older adults and residents of the county during the pandemic?
Yes, well, I can give you a sampling because there have been so many different efforts going on from so many different entities. But a good sampling is starting with Engage at Home, with the program that Lylie Fisher set up for caregivers, where there's so many resources for caregivers available, both to help them stay engaged and intellectually connected while they're at home during the pandemic, and also to reach out for other services they may need. There's another program that the county pulled together called Thrive at Home. This is for people of all ages. Many different parts of the government and our private sector and public sector work together to pull this together. And it's a website where you can find things to do on exercise, on arts, on outdoor activities, on lifelong learning, and very easily available through the website, a huge range of activities. One of the hugest efforts I think the county undertook was to meet the needs of those who needed food, whether they couldn't afford food anymore, or whether they couldn't get to the food anymore, or whether they were afraid to leave their homes because of COVID. The county has organized resources across the county of all the different organizations that help provide food for people in need of it. And the county is involved in food distribution and, in some cases, as Steve mentioned, getting it to your home if you can't get out to get it yourself. They have organized a huge information resource, both through the 311 telephone number or the 240-777-3000 number, to get you information on COVID, anything related to COVID, as Lily mentioned, and testing, and a website that is just chock full of information about COVID. How to get where you need to go, transportation issues, food issues, medical appointments, and so forth. A really innovative program they started was called COVID Corps, where the county, various different departments in the county have hired youth, young people, I think it's 18 to 22 or something like that, maybe 16 to 22, but young people to help older people and the county with various aspects of technology, people who need help, how to use the technology they have, they've been helping with food distribution and a number of other tasks around the county during COVID to help support the COVID effort. And a lot of the government entities, I know the rec department and the libraries and the lifelong learning institutions, and we have an organization in the county called Senior Planet. Many of those, everybody has transferred all of their in-person classes to online just pretty seamlessly, so that a lot of those classes that people love and that keep them engaged and informed are available online throughout the different parts of the county government. And finally, I won't touch on everything, but I'll say that the transportation department has reorganized everything about how they handled buses and ride-on and operations like that, so that people stay safe. They, attended to the needs of the first responders first at the beginning of the pandemic to be sure they could get to work and get home again, and that people who board these buses are safe and have the distancing and mask wearing that they need. So those are just some instances.
Thank you so much. And one of the things I often hear is the word county as a proper noun and referring to the county government, which is very important. And as you've described, doing a lot of innovative new things to address the public health crisis. But as you laid out at the beginning, it's all about the public-private partnership. And what we know is that often it's private organizations that are really the implementing wing of some of those initiatives. So Steve, would you talk a little bit more about how GROWS and its members have been playing a complementary role to the work that the county is doing, either in terms of right now during the COVID crisis, but also more broadly in terms of that complementary dynamic between the local government and the private sector companies and organizations?
Absolutely. So GROWS really is an umbrella organization. We focus on a lot of different things. There are members of GROWS who serve on the Commission on Aging. There are members of GROWS who serve on the age-friendly committees like I do on the Home and Community-Based Services. I also sit on the board of Potomac Community Village, which is a neighbor helping neighbor organization. So what you find is that GROWS members really span across all areas of need. There are realtors, there are accountants, there are physical therapists, and we're all working to serve seniors in the county. And part of our role is advocacy to make sure that we are focusing on senior serving issues. So we may have groups that go to Annapolis and put forth a pro-senior agenda on behalf of the seniors that live in the county. It's really a pick and choose sort of thing. So members of GROWS aren't required to do anything. It's just a networking organization. But those of us that are interested pick up the mantle of something that we find we're very interested in and run with it and try to help and be part of the governmental action or quasi-governmental actions that will help advance the resources available for seniors throughout the community.
Okay. Thank you, all of you. You've brought so much knowledge to this discussion today, and it's really interesting to listen to you speaking, particularly about the response to COVID-19, because I think one of the things that I've observed broadly is that Montgomery County's response has been stronger than it could otherwise have been without the pre-existing infrastructure and set of collaborations that we've had in place to do work related to supporting our older adults to live healthy and active lives later on. And that collaborative spirit that existed previously has really positioned us well to continue to work together nimbly and navigate this crisis effectively together. There is still a long way ahead of us, but we rise and fall together, and so the importance of this partnership has never been greater. I've got a few reflections from having listened to the conversation today, and so I'm just going to try and share those to summarize and wrap up the conversation. The first is aging is a very complex process. Steve, you just mentioned a number of different types of professionals that will serve specific needs, older adults related to the process of aging: real estate, accountancy, and physical therapy. We've spoken a lot about home and community-based services. We can think about healthcare. We can think about so many different things that people need at different stages in life. Aging is also a dynamic process. You don't hit a specific birthday and then everything becomes a need all at once. You may have different needs at different points in time as you're growing older. And in a community as diverse as Montgomery County's, we also have people experiencing those different life stages with varied cultural lenses and cultural experiences. So to really make Montgomery County a community for a lifetime, which is the age-friendly mission, it's important to have that multifaceted approach. And that's really what the age-friendly structure provides for. It's a mechanism for thinking about all the different types of services that older residents may need and benefit from, and for creating an infrastructure to bring those together in a strategic and organized way. There's the old saying that it takes a village to raise a child. Well, I would say it takes a community to provide all the different types of services that are essential to helping our residents live active and engaged lives for as long as possible, and also to make sure that they can age with choice and dignity in later life when they can't be as active and engaged. But all of those services are provided by different types of organizations. So how do you make sense of it all, especially if you're not a professional in this field? How do you determine which things you're going to need when? Where do you find it? As I think Steve shared in one of his comments, it's important to have a quarterback for that process, and that could be an aging life care professional. That's the person that can help you make sense of the different types of services that are available to help you and your loved ones age in place. We also spoke a lot about self-care. Lily, you shared the work that the county and the ARC of Montgomery are doing. You can't take care of others if you haven't looked after yourself first. So making sure you're getting the services and support that you need as an individual, and that is going to make you a much stronger caregiver. So understanding those respite options is very important. And when in doubt, visit the county website or call 240-777-3000. That phone number is going to be your open door to start the learning process, to find out what's available. And importantly, really importantly, even if you don't think you need services now, or you are caring for a loved one and you think you've got it under control at the moment, don't wait. Take the steps now to find out what's out there, what's available, what you might qualify for, and have a plan ready so that you can be prepared to put it into action when you need it. Thank you all again so much, and thank you for tuning in.